guys, welcome to Didactics Online. I'm Rob, and I'm here with Brandon. We're going to talk today about thoracic diagnosis, the rule of threes, and high velocity treatment techniques. So first off, you always just want to take a look at the body mechanics. Take a look and see what tight muscles there are, where it looks like the body has its normal changes and patterns. Okay, so when we just start palpating, you kind of feel for tissue tension, and already I notice, just as I'm touching him, I'm kind of giving a little rotational emphasis here. On his left side, when I push anterior, there's a lot more resistance than when I push on the right. So that's cluing me into thinking that he's got something rotated to the left. Now, to really get into thoracic diagnosis, you have to understand what we call the rule of threes. So we've got a few models here to show you. So, we've got a good model that has the rib cage, thoracic, lumbar, sacrum, and we have a good, nice steel rod holding it into pretty close anatomic relationships. When you diagnose the lumbars, it's pretty well known that you can find a spinous process and go straight out to the transverse. Then you push on either side and you can pretty much determine rotation by the side that won't spring anterior. The thoracics are a little different. As you can see, the spinous process starts to angle down and it doesn't always line up with the transverse process right off the side. So this is where our rule of threes comes in. The first three, 1, 2, and 3, the spinous process lines straight up with the transverse process. The second ones, 4, 5, and 6, you find the spinous process and you go half a segment up to the next one and you go out and find the transverse process. 7, 8, and 9, the nose gets a little bit longer here and you go up a whole segment and then you go out and that's the one below it. 10 is just like 7, 8, 9, 11 is just like 4, 5, and 6, and 12 is just like 1, 2, and 3. So everybody gets confused. Okay, I find a spinous process. Do I go up? Do I go down? How do I find that transverse? Well, I like to tell everybody it almost looks like the face of an elephant. So think about the spinous process as the trunk hanging down, and the transverse process is just like the ears above. So there's also ways to think about facet orientation, and we can show you on a model that we can actually move around a little bit more. So if I bend this all the way down, some people will even say with the superior facets, it kind of looks like the head of a giraffe. So you can see these are the horns, we've got the ears, and then the face of the giraffe. Whatever you like, giraffe, elephant, it'll help you remember to find the spinous process and go up. So this is how you're going to really find your segments. Now, you got a whole back. Where are we going to start? We're about right in the middle where I was looking to see where Brandon has restriction on the left side. So we can use a couple of landmarks to really clue us in. So first off, the spine of the scapula generally coordinates with the spine of T3. Then, according to rule of threes, you can figure out where the transverse process is and what's rotated. The inferior angle of the scapula, which is right here on Brandon, generally coordinates with T7. So this is about right where we were looking. So T7 follows the rule of threes to where I have to go up to T6 and then out to the transverse processes. Okay? So now I want Brandon to flex and extend over this segment to find out if it's neutral, flexed, or extended. So curl down just a little bit, and it's important to get into this level. You want this level to flex. Okay? I flex here, maybe it gets a little bit better. Now I want you to extend over this segment. And as he extends, maybe it gets a little bit worse. So, if it gets a little worse, then we'll call the opposite one flexed. That's how you're going to determine what we've got here. So let's say this segment is flexed, rotated to the left, side bent to the left. He's got pretty good restriction, so we're going to go ahead and HVLA that. Now, if I wanted to count a little bit lower, you can always use the tip of the 12th rib to find T12 and count up. If we're way up at the top, I can use T1 by flexing his head down, looking for a really prominent bump, and then I put a finger right here, a finger above, and a finger below. As I extend his neck or rotate him, C7 will move before T1 because of its direct articulations with the ribs. So it's always important to know how you can rapidly find different areas. Now that I know I have a good diagnosis here, let's show you how to treat this with a Kirksville crunch. Alright, Brandon, go ahead and line your back for me. And let me actually get you to put your head down here. So, Brandon's rotated to the left, side bent to the left, and he's flexed. So what I want to do is see how well I can push this one to the right and try to get a little bit of side bending to the right while I work with the flexion extension. So, whenever you're doing the Kirksville, you always want to put the opposite arm over the adjacent. it gives you a little bit more leverage. So when I lean on his arms, I can push them down together. If it's adjacent over opposite, when I push down, his arms can slide apart and you won't build up the same amount of leverage that you can. So he's opposite over adjacent, that's the first part. Next, I want to hold his elbows right in the segment that I want to pop. It builds up most tension, and think of it kind of like holding onto an accordion. When I hold him here and flex his head up, it's going to open that space and allow me to push T7 right back in. So I'll put all of my weight right on his elbows, as they call it, the osteopathic thruster will hold on to the segment, and I'll grab Brandon's elbows with my stomach. I roll him over, I contact the segment that I wanted to articulate with my thenar eminence, and I put it on the more rotated transverse process. Now, I like to come over the patient and have them lift their head a little bit. Go ahead and relax your head, Brandon. I've got full control of him. He's not moving around too much. He doesn't feel like he needs to hold his head so it braces his back muscles. And I'm going to go ahead and flex him up to the segment and side bend him to the right, away from the direction of ease into a direct barrier. I'll get all my weight right on top of him and have your patient take a deep breath in, breathe all the way out, and I drop. I got a good articulation right where I wanted without causing too much harm for Brandon. How'd it feel?
Great.
Nice and easy. Alright, so if he had higher segments, we make just a minor modification. Brandon, we can take his arms, pull them even tighter, and do something similar, but sometimes people have shoulder problems. I know Brandon's had some shoulder surgery in the past, so you can hold his arms behind his neck. It can be easier to put your force through the elbows. If that's still a lot of issue, go ahead and fold your arms again. Sometimes you can put just enough weight here and use the head as a lever so you can flex up and pop a couple in the upper thoracics easily. There's also a technique called the chin pivot. So we're going to have you put your head down here, Brandon. And I want you to go ahead and put your chin right in this slot. So the chin pivot really works good for type 2 dysfunctions, where they're flexed, rotated, side bent to the same side, or extended, rotated, and side bent to the same side. It doesn't work quite as well with neutral mechanics because you don't correct as many of the motions and put them direct to line up a very good high velocity technique. Another thing to be said about the chin pivot, it works very similar to the way that the facet orientations go at the cervicals, so you can pop a couple of the cervicals as, with the joints of Luschka involved. So if I had him all the way extended, we could go down to T4. So I don't want to extend him all the way. I want to make sure that I'm getting right about T1, where I know Brandon has a little bit of an issue. Okay? He's a little bit more rotated to the left, so I'm going to try and side bend him and rotate him over to the right, because I know he's got a good type 2 here from earlier. So he's lined up well. This is comfortable for where I want him to be. I'm going to put my hypothenar eminence, more along my pinky, on that side of the transverse process. Now when I rotate him over, I'll bring him to a barrier. He breathes just a little bit, all the way out, give him a little pop, and things will go nice and easy. So this is a good technique for you to put your patients on the chin hold, or you can have them just bring a hand up. If you don't have a good slot in your table, they can put their chin right there, so it helps you correct from over-rotating the neck. If he didn't have that and it was just flat, I could push his head all the way down and get too far and cause him a little bit of discomfort. With his hand there, almost like an L shape, it won't over-rotate him and I build up a little extra force. Sometimes your patients will like that a little bit better. So these are some of the quick ways you can diagnose and treat thoracics. We appreciate you guys watching. Thanks again for all your support. Comment on the website, and we'll see you next time on Didactics Online.